The first question that we're going to look at today is, what is the definition of type 2 diabetes and how would you describe that to someone?
Type 2 diabetes is a chronic progressive metabolic disorder by elevated blood glucose levels due to insulin resistance or insulin um, deficiency. In the pancreas here, the organ in our upper left quadrant, um, have what they call beta cells. And what happens is that there is an insensitivity that comes from the body over time trying to regulate the glucose in the bloodstream from having a sedentary lifestyle or having poor nutrition. Over time, the insensitivity to the beta cells releasing insulin from the poor nutrition and sedentary lifestyle, this causes beta cell dysfunction.
Going a little further in, the next thing we're going to look into is what type of clinical manifestations would you expect to see with a patient who had this disease?
So some clinical manifestations that can manifest in someone's body with type 2 diabetes is very similar to type 1 diabetes.
With the common symptoms of having polyuria, polyphagia, and polydipsia. And so that's going to be excessive urination, an increased appetite, and then increased thirst. So the main part on that is that the cells are experiencing dehydration from the lack of that fluid in there. So the body's sensing it's dehydrated. And then with polyuria is all of that, that's the excessive urinating, with the body experiencing hyperglycemia and then having the increased thirst, the dehydration. The fluid there is the kidneys are receiving all this extra fluid that's not inside of the cells anymore, and that's causing the increased urination or the frequency of it.
Polyphagia, the tissues in the body are starved due to the lack of glucose in the cells itself. And this happens due to the insulin not being produced by the beta cells and not allowing the glucose in the bloodstream to enter the cells.
Glucose will be inside of the body, but it will not have, due to the lack of the insulin, it can't enter them. And so you'll see the increased glucose levels without actually experiencing the role it needed to do. In type 1 diabetes, they more commonly can present with diabetic ketoacidosis, which is not something that type 2 diabetes is going to experience, or at least as frequently. With type 2 diabetes, you're more likely to experience hyperosmolar hyperglycemic syndrome, or HHS for short, which is still going to result in the increased levels of glucose in the body, but not presenting in that acidic state. Someone might be curious to know what type of effect this disease has on the body and on the organs inside of it.
Since diabetes is a chronic and systemic disease, it can impact many different organs in the body and many different organ systems. And many of those effects stem from the impact that diabetes has on the circulatory system as well as the nervous system. So, for example, starting from the top, cerebrovascular disease is caused in patients with diabetes due to increased levels of glucose in the blood in a patient with diabetes. These can lead to buildup of plaque and damage to the blood vessels, and that can impact the amount of oxygen and nutrients that are reaching the brain, as well as it can cause deadly strokes and blood uh, blood clots and things like that that can impact the brain. And that can also impact the eyeballs because the lack of blood flow to the eyeball can cause decreased vision, as well as increased the hypertension that is caused by hypo the hypertension that is caused by hyperglycemia can also impact the eyeballs, causing things like glaucoma, vision impairment, and possibly blindness. The damage to the circulatory system caused by diabetes can also have impacts on the heart, including chest pain, myocardial infarction, and cardiac arrest, and possibly death, as well as shortness of breath. Further away from the heart, in the extremities, such as the hands and the feet, peripheral artery disease can also occur, and this occurs when the blood vessels are damaged in these areas, and that can cause decreased blood flow to the hands and the feet. And this can be a problem with diabetes when combined with neuropathy, which is another thing that I'm going to talk about. So, neuropathy is when your nerves are damaged due to the lack of blood flow. And when combined in a patient with diabetes, the peripheral arterial disease as well as the neuropathy, that can cause, a small cut that to go unnoticed. They can get like a paper cut or step on a rock or something, and that can cause a cut that doesn't heal properly due to the lack of blood flow, as well as they might not notice it due to the lack of pain in that area, and that can be a big problem. Hyperglycemia can also damage the way that white blood cells function, leading to immunosuppression. And when combined with the high risk of small cuts on hands and feet, as well as the lack of sensation, this can also lead to a high likelihood of infection, higher than normal in the feet and the hands. Hyperglycemia also adds to the risk of infection because many bacteria feed on the glucose that is in the blood, such as a candida infection. The candida bacteria feed on the glucose. High glucose in the blood is also filtered out through the kidneys. This is using the kidneys more than usual, and it can lead to nephropathy as well as other types of damage to the kidneys. Nephrons in the kidney, which are the site of the filtration, because of the glucose going through them, that can cause damage to them, and then that can lead to proteins being excreted in the urine. So another sign of diabetes could be high albumin in the urine. And the nerve damage in the body extends to nerves in the autonomic system, which control different bodily functions that can cause autonomic neuropathy. And symptoms of that can include decreased sweating, bladder dysfunction, bowel dysfunction.
And lastly, if you had a patient with this disorder, what parts of a head to toe assessment would be important when caring for this patient?
So during a head-to-toe assessment, you want to make sure that you analyze and observe the patient overall appearance and cognitive and alert and orientation. For a diabetic patient, definitely making sure that you get their vitals done. Along with their eyes, you want to make sure that you do certain eye exams, check if they have any cataracts, glaucoma, or if they have any present or new eye issues that they tell you. And along when you're assessing the eyes, you want to also make sure for symmetry and any signs of drooping. That could be an indicator that they're suffering from a TIA or a stroke.
Including edema as well. A patient that has type 2 diabetes is going to commonly present with it's related to obesity, and so monitoring the vital signs and their blood sugar levels is going to be key for knowing how to manage their care. So you're going to want to inspect their skin, especially doing like a cap refill to see how well the blood is perfusing to the area. You're also going to want to do a very thorough assessment of the lower extremities and the upper extremities, because that's where they're going to have a decreased sensation and blood flow to those areas, and they're more prone to not being aware to an injury in that area, and that decreases the ability of the white blood cells to come and deal with the infection or cut injury while it's small before it becomes a larger issue. And so the lack of the white blood cells acting appropriately in the body because of the neuropathy that they're experiencing and the lack of sensation because they were not aware of an injury are all something that we're going to want to keep in check when we're checking for a head to toe on if anything like that is located there.
Another thing to focus on when doing a head to toe assessment with a patient who has diabetes is the cardiovascular system. So make sure that you are listening to all the different 5 landmarks of the heart with your stethoscope and noting if there are any murmurs or other abnormal sounds. And make sure you check the peripheral pulses, such as the radial pulse and the pedal pulses, as well as check the skin for proper perfusion and skin color and temperature. Note things like abnormal bruises or discoloration on the hands or feet or legs, though to make sure that you know if the patient smokes or not. It's also important to focus on the kidneys. When doing a head to toe, the main thing to do with the kidneys is to palpate them on the lower back, and the patient will tell you if they feel any pain, and that could be a sign of some kidney issues. A sign of cardiovascular disease is edema, so make sure that you're checking the feet and the arms and everything for edema.